Okay, we're continuing with the book here, Prevent and Reverse Kidney Disease by me, Pete Rogers. We're on chapter 4, page 62. If you're following along in the book, we're going to be talking about atherosclerosis. So I know you might have probably heard me talk about atherosclerosis before if you follow my channel, but it'll be most of the same stuff, but a few new things. So the first thing to know, what is atherosclerosis? Atherosclerosis is a blood clot. I can tell you 99.9% of doctors do not know that. I did a fellowship at Harvard, imaging-guided surgery, interventional radiology with the emphasis on vascular disease, tons of lower extremity thrombolysis, angioplasty, stenting, etc. And I didn't know that. When I was a young guy, I thought vascular interventional radiologists, vascular surgeons, cardiothoracic surgeons, vascular surgeons were the atherosclerosis experts. But I was wrong. The atherosclerosis experts are pathologists who look at it under a microscope. And they have a big advantage as well that they don't care what the treatment is. A vascular surgeon cannot criticize surgery. Interventional cardiologists cannot criticize stenting. But a pathologist does not have a dog in the fight. They just look at it under a microscope and they go, it's a blood clot. The blood clots, and then the immune system comes in and tries to reabsorb the clot. That's called, a small clot's like a small hematoma. And then the immune system comes in and tries to reabsorb it. That's what it is. And by the way, that's an AO, academic orgasm. Because you have a lot of power once you understand atherosclerosis is a blood clot. Because then you can extrapolate from there and say, well, anything that causes blood to clot is a risk factor for atherosclerosis. Well, what is a blood clot? A blood clot is when red blood cells stick together. Well, what sticks red blood cells together? We already know this. High-fat diets, chylomicrons, triglycerides, and LDL cholesterol. So they're prothrombotic. We know from leaky gut, you get bacterial endotoxins, LPS from gram-negative bacteria, lipopolysaccharide, LTA, lipoteichoic acid from gram-positive bacteria. They catalyze an amyloid transformation of the fibrinogen to go from an alpha helix secondary protein structure to beta-pleated sheet, where it now becomes prothrombotic. And they form these relatively refractory types of clot, dense matter deposits they're called, that are hard to lyse, hard to dissolve. So leaky gut causes clotting. And what causes leaky gut? A lack of dietary fiber plus anything toxic to the gut, like alcohol, vegetable oils, high-fat diets, emulsifiers, a lot of chemicals in processed food, fluoride, aluminum. Okay, so anyways, what else causes blood to clot? Severe dehydration, smoking tobacco increases the risk of blood clotting, infections, diabetes, elevated serum uric acid from too much high fructose corn syrup, for example, too much meat, excessive stress, sleep deprivation, caffeine. They all make the blood more prothrombotic. They raise the amount of blood lipids. They increase the amount of clotting factors. Okay. High-fat diets also increase the predisposition to clot through the clotting factors. So anyways, so you just avoid all these things. And can atherosclerosis be reversed? Of course it can. We know from Caldwell-Esselstyn, we know from Kempner, we know from Pritikin, we know from McDougall, we know from Armstrong, and a whole bunch of animal research. You eat a low-fat diet, you can reverse it. And that's also why I think infections are a secondary thing. I don't think they're a primary cause of atherosclerosis. Because I think the bacteria are just floating around in the blood, and then they see a blood clot, and they go there and go, hey, that's a nice meal for us. It's like a fast food restaurant, a little bit of atherosclerotic plaque along the side wall of the vessel. Okay, the necrotic core can be reabsorbed. The lipid core can be reabsorbed. You're not going to reabsorb the calcification, now, even though some people claim you can. Yeah, maybe, but I'm not believing it until I actually see it in clinical practice. I look at CT angiograms all the time. I've never seen it reabsorb. Okay, anyways, here's the atherosclerosis plaque, and initially you've got the clot, and then the circulating endothelial precursor cells come along and they cover it up. That's how it gets subintimal. The lipid core, necrotic core can be reabsorbed. Then this is the fibrous tissue, scar tissue, majority of the plaque. The more acellular it is, the less likely it is to be reabsorbed. Okay. And then what doctors figured out that atherosclerosis was a blood clot? The pathologists. Okay, and like here's a good example. Here's a guy named Karl Rokitansky, Dr. Karl Rokitansky. This painting from 1853, he was a pathologist back in the mid-1800s, and he looked at atherosclerosis and said, it's a blood clot. In the mid-1900s, cholesterol craziness took over because they wanted to sell the drugs. Okay, and Ansel Keys, had figured out that high-fat diets with elevated blood cholesterol were major risk factors for atherosclerosis. They also saw from Pekka Puska in Finland, when they lowered the dietary fat, they dramatically reduced the incidence of coronary artery events. Okay, CAD means coronary artery disease, and that really just means coronary atherosclerosis. Okay, when people say heart disease, unless they specify, they're talking about coronary artery atherosclerosis. And the excitement flame about cholesterol from Ansel Keys was sort of fanned up by the introduction of statins, coronary artery bypass surgery in the late 1960s, statins, drugs 1987, stents came along in the mid-1980s. And the cardiac surgery doctors thought they had heart disease all figured out. Everybody was excited, the so-called irrational exuberance. Okay? And then the great atherosclerosis research pathologists, like two of the best are Gregory Sloop and William Roberts. They were like trying to remind people, hey, it's a blood clot. And by the way, William Roberts has his own channel. It's just his name, like William C. Roberts. And you go to his channel, and I find it funny, you'll go and see the greatest lectures ever on cardiac pathology and coronary artery disease, atherosclerosis. And he would have an average of about 50 views for his lectures. I also was recently reading about dentistry, and Hal Huggins, who's like the greatest dentist who ever lived, he'll give this lecture on electrogalvanism, mechanisms of current generation and their consequences between different types of metal in the mouth. Let's say you have gold filling and you have a silver filling, mercury amalgams and all this stuff, and the significance of those currents, how they affect an operative approach, how they affect the likelihood of symptoms. It's a masterpiece, a genius lecture. And he had like 340 views in over 3 years. Okay, so what I'm trying to say is the best of the best of the best lectures on YouTube, hardly anybody watches them. And then there's all these phony, half-retarded jerk-offs trying to sell stuff, and they have millions of views. So don't judge a video by the number of views if you want to learn something. All right, like the paleo, keto, carnivore, low carb, complete nonsense, just a way to chump all the proles. The masterpiece paper by William Roberts, like the best paper ever written on coronary artery disease, is quantitative extent of atherosclerotic plaque in the major epicardial coronary arteries, okay, in patients with fatal coronary artery disease, okay. Oh, and here it is if you want to see the paper. If you're serious about understanding coronary artery disease, you might find that enjoyable. I'm going to tell you the key points of it, but it's a masterpiece. It's a genius paper. Okay, so some of the things he observed when he compared coronary artery autopsy specimens with cardiac cath, results, was that cardiac cath always underestimates the amount of stenosis. Because when cardiac cath's estimating a stenosis, they compare it to what they presume is normal adjacent coronary, but it's not. It usually has a baseline stenosis of its own. So it looks like about 50% stenosis on cardiac cath. At autopsies, really 75% stenosis. They were able to take the autopsies and compare them to the cardiac caths. What looks like 75% stenosis at cardiac cath is really about 95% cross-sectional area stenosis at autopsy. And another myth that William Roberts put an end to was this idea of single vessel coronary artery disease, because they used to sometimes do a cabbage, let's say, on one vessel, or they only stent one vessel, think they're done treating the patient. But the reality is, from William Roberts, it's always diffuse. Coronary artery atherosclerosis in general, it's a systemic disease. It's always diffuse of a similar severity, meaning that if you've got a tight stenosis in one artery, you can bet that there's severe atherosclerosis in the other ones, okay? A significant amount of atherosclerosis in the other ones. That's highly relevant because what it's saying is you're kidding yourself if you think you're going to do a single vessel coronary artery bypass. But it's even worse than that because on cardiac cath you can only see the more advanced stenoses. You can't see the mild stenoses, and it's more often the mild stenoses that progress to vulnerable plaque and rupture and coronary thrombosis and occlusion. So you're not really even treating the stenotic lesions. Stenosis means narrowing. The stenotic lesions that are most likely to lead to vessel occlusion, myocardial infarction. So what are you doing? You're basically opening up the major vessel to decrease symptoms of angina, for example. And it can be helpful for that, but it's not going to reduce their risk of a subsequent heart attack. So it's not going to prolong their life necessarily. It can give them some symptomatic relief, but what I'm basically saying is coronary artery stenting and surgery is totally overrated. Dr. McDougall's got extensive lectures on the subject, and it's true. And the logic of it just makes it pretty obvious once you understand what's going on. So So there it is. You cannot effectively bypass coronary artery disease. There's always more. And you're not going to be able to know which lesion to treat because cardiac cath doesn't show it. Okay? So here's what William C. Roberts did as well. He made what he called a quantitative assessment of coronary artery disease. He marked off every 5 millimeter increment in the left anterior descending artery, left circumflex, left main, and the right coronary artery. And then he would compare them with the cardiac cath, and he would also estimate how much disease was present and where it was present. And again, the key finding was it was always diffuse. Okay. In patients with MI at autopsy, 34% or more of the 5 millimeter arterial segments had at least 76% or more stenosis. Okay. In severe disease, the number of segments with over 72%, the number of segments having over 50% stenosis was 72%. Not a single segment was devoid of plaque. It's always diffuse, always, okay? There's no easy answer for that with stenting or bypass because those are focal treatments. He also confirmed that basically it's a chronic organizing hematoma. It's a blood clot. William Roberts knew that, Rokitansky knew that, Gregory Sloop knows that, and anybody who's seriously studied it and looked in there knows that, okay? With the myocardial infarction, you'll see the acute clot. Often in a chronic stenosis, of course, it's been organized. You'll see recanalization channels like you see in an old clot in a chronic pulmonary embolism. Again, recanalization of a blood clot. It'll often have a laminated appearance like the rings on a tree, like if we cut a tree stump. Again, like a process of ongoing clot formation and regression. Okay? So like Dr. Roberts is saying, atherosclerosis is a systemic disease. It goes everywhere in the body. So the only way to treat it intelligently is low-fat vegan diet. You can try drugs. Drugs help a little bit, but they come with consequences. You know, statins increase your risk of diabetes. So you're robbing Peter to pay Paul, trading one problem for another. Okay? Yeah, they have some therapeutic benefit, but that's a lot of side effects. Increased risk of diabetes, increased risk of cognitive decline. It's a mitochondrial inhibitor. Okay? All right, and he's a big fan of statins, but I think he might have been getting some money from the statin company is my impression. I don't know that for sure, but that was my impression. I have some reason to say that. Okay, statins are mitochondrial inhibitors. They increase risk of diabetes, other potential side effects including rhabdomyolysis, muscle weakness. Who wants that? Okay. Also, I can tell you, I have a lot of internal medicine doctor friends, and they tell me even if the patient's on statins and all their numbers are good, they still sometimes have heart attacks. The benefit of lowering total cholesterol by diet is stronger than the benefit of lowering it by statin. Me personally, I would never take a statin. Okay, the vast majority of people can adequately prevent hyperlipidemia and atherosclerosis with a low-fat, low-sodium diet, no oil, and without simple sugar sweets, without taking any medicines. Okay, other risk factors for coronary artery disease, obesity, smoking, tobacco, hypertension, diabetes, elevated CRP. That could be dental, could be from a lot of mercury amalgams, periodontal disease, being sedentary, excessive psychological stress, sleep deprivation, caffeine. Dr. Roberts said that the Ansel Keys 7-country study was the best one to show that lowering blood cholesterol prevents heart attack. We talked about Finland, where they ate a high-fat diet, had lots of coronary artery disease. The Japanese did not, even though they smoked a lot of cigarettes, because they ate a very low-fat diet with all that white rice, 1% of calories from fat, they didn't have that much coronary artery disease. They had intracranial atherosclerosis from the hypertension and the high sodium. Okay, Dr. Roberts says, if you give herbivores, rabbits, monkeys, a diet high in cholesterol or saturated fat, they'll all get atherosclerosis because they're similar to humans. He said people should eat a plant-based diet, keep their BMI less than 25, don't smoke tobacco, and don't drink alcohol. So anyways, there it is, the greatest pathologist in the world of the heart, and that's what he has to say. Pretty much the same thing we're saying. Anyways, I hope you found that helpful.